Welcome to an in-depth at Cerebral Palsy, a group of disorders affecting movement and posture. Join us as we explore the causes, symptoms, diagnosis, and management of this complex condition. Cerebral palsy isn't caused by a single factor, but rather a variety of events that disrupt normal brain development. These events typically occur during pregnancy, around the time of birth, or in early infancy, while the brain is still developing. Potential causes include brain infections or encephalitis, head injuries, bleeding in the brain, fetal stroke, lack of oxygen to the brain during labor and delivery, premature birth, and genetic abnormalities. In some cases, the exact cause remains unknown. At its core, cerebral palsy involves damage or abnormalities in the parts of the brain that control muscle movement. This damage disrupts the brain's ability to properly send signals to the muscles, leading to difficulties with coordination, balance, posture, and muscle tone. The specific areas of the brain affected and the extent of the damage determine the type and severity of cerebral palsy. Cerebral palsy is the most common motor disability in childhood. While specific numbers vary depending on the study and region, it's estimated that cerebral palsy affects approximately 1 to 4 out of every 1,000 live births worldwide. It's important to remember that cerebral palsy isn't contagious or progressive, meaning it doesn't get worse over time. The signs and symptoms of cerebral palsy can vary widely from person to person, depending on the location and extent of brain damage. Common symptoms include difficulties with movement and coordination, stiff or tight muscles, tremors or involuntary movements, delays in reaching motor milestones like sitting, crawling, or walking, difficulty with speech, swallowing, or feeding, and intellectual disabilities. Some individuals with cerebral palsy may also experience seizures, vision or hearing impairments, and problems with bladder and bowel control. Diagnosing cerebral palsy typically involves a comprehensive evaluation by a team of medical professionals, including pediatricians, neurologists, and physical therapists. This evaluation includes a review of the child's medical history, a physical examination to assess muscle tone, reflexes, and motor skills, and neurological assessments to evaluate brain function. Imaging tests, such as MRI or CT scans, may be used to identify brain abnormalities. It's important to note that a diagnosis of cerebral palsy may not be possible until a child is several months or even years old. Cerebral palsy is often classified based on the type of movement disorder present. The most common types include spastic cerebral palsy, characterized by stiff muscles, athetoid or dyskinetic cerebral palsy, characterized by involuntary movements, ataxic cerebral palsy, characterized by problems with balance and coordination, and mixed cerebral palsy, which involves a combination of these types. Further, cerebral palsy can be further classified by body parts affected, such as monoplegia as one limb, diplegia, primarily legs affected, hemiplegia is one side of the body, and quadriplegia is all 4 limbs affected. While there's no cure for cerebral palsy, a variety of treatments and therapies can help manage symptoms and improve quality of life. These may include physical therapy to improve strength, flexibility, and motor skills, occupational therapy to help with daily living activities, speech therapy to address communication and swallowing difficulties, medications to control seizures or muscle spasticity, and assistive devices such as braces, walkers, or wheelchairs. In some cases, surgery may be recommended to improve muscle function or correct deformities. The goal of treatment is to maximize the individual's independence, function, and participation in life. Unfortunately, completely preventing cerebral palsy isn't always possible. However, certain measures can reduce the risk. These include ensuring pregnant women receive proper prenatal care, vaccinating against infections that can harm the developing brain, preventing head injuries in infants and young children, and managing medical conditions that can increase the risk of premature birth. Ongoing research continues to explore potential prevention strategies. The long-term outlook for individuals with cerebral palsy varies greatly depending on the severity of the condition and the availability of appropriate treatment and support. While some individuals may experience significant limitations, many others can live fulfilling and productive lives. Recent research has focused on developing new therapies to improve motor function, cognitive abilities, and overall quality of life. Advances in assistive technology, such as robotics and brain-computer interfaces, are also offering new possibilities for individuals with cerebral palsy to enhance their independence and participation in society. Further, there is a lot of current research being conducted related to early identification and the use of stem cell therapy.